by Edmonton Riverview.
Thank you, Mr. Speaker. The Wild Rose cares about patients who are suffering in long wait times in our province. But no matter who this government puts in charge, things are just not getting better. And the problem isn't new. It has existed for years, and this government has been told over and over and over. We can only be thankful for the heroic work of our healthcare professionals who are keeping our healthcare system together. Can the Minister of Health tell Albertans why he is failing to put a stop to growing wait times, leaving Albertans to suffer?
Honourable Minister.
Well, Mr. Speaker, this government takes the issue of wait times very seriously, and in answer to the earlier question asked by the Honourable Leader of the Official Opposition, I talked about some of our successes in reducing hip and knee surgery wait times, in reducing cataract surgeries, in reducing the wait for bypass surgeries, Mr. Speaker. So there is much work to be done right across the country, including here in Alberta. Mr. Speaker, the answers to this in many cases are found in innovation. If we look to central assessment and central intake of patients, as we are doing in the case of hip and knee surgery, Mr. Speaker, we see amazing results. And the honourable member is right to credit frontline workers for success.
Thank you. Given this is impacting real people and they expect real answers, and today's report shows Albertans are waiting an astonishing 128 weeks for cornea transplants, while people in Nova Scotia only have to wait 24 weeks, will the minister explain why he waited until last Friday to do a press release to buy more transplant tissues while Albertans have been less suffering?
Well, Mr. Speaker, I'm delighted that the honourable member recognizes the initiative that has been undertaken to reduce waiting times for cornea transplants. As the honourable member probably knows, there is a growing demand for this procedure. It's often conducted in connection with cataract surgery. Mr. Speaker, last week we showed that Alberta once again leads the country. Our plan to import additional cornea tissue, I should say, from BC and from the United States will allow us to do an additional 500 surgeries between now and Christmas and reduce the waiting time from in the past 3 years to 3 months.
Honourable member.
Minister, you should have done it earlier. You know what is extreme, Mr. Speaker? Albertans waiting 3 weeks for a pacemaker when the Canadian average is 3.5 days. Why, Minister? Why?
Mr. Speaker, what is extreme is the notion put forward by the earlier this afternoon in question period by the Leader of the Official Opposition that the solution to reducing wait times in our province should be to send patients outside of our jurisdiction and perhaps outside of the country for all we know in order to receive services that are here and available in Alberta. Mr. Speaker, we are leading the country in terms of innovation to reduce waiting times in many, many areas. It's a testament to the innovation and hard work of frontline staff in Alberta Health Services, and I thank them for it.